You're watching Begasisa's Health Beat, and we're talking about cervical cancer vaccines for young women. With me is Dr. Langanani Mbodi, the head of Gynaecology at Wits University. Langanani, thanks so much for joining us today. What is the link between HPV and cervical cancer?
If you have to look at it, the cervix, which is also called the mouth of the womb, is constituted by three layers. There's a deeper layer, the middle layer, and the superficial layer. So we know that 99% of cancers of the cervix are from the HPV itself. So what happens is 99% of people who have sex, whether you use a condom or not, any other method or not, you'll have HPV. But 90% get rid of it because there's a good immune system. The way it works, HPV goes and infects the deepest layer and sits there. The longer the infection stays there, the more it infects more and more layers and more layers. And it changes the DNA of the cervix. And the cells now change and become abnormal. If they're allowed to progress without treatment, then they can become cancerous. You need a healthy immune system for you to fight HPV. So it means that the 90% of people with a healthy immune system are able to get rid of the HPV at early stages. The problem is the 10% that can't. You cannot have a healthy immune system when you don't have enough food, good protein, good nutritious food. That's number one. Number two, the prevalence of HIV. HIV, it almost goes with HPV, together with HPV. But HIV also affects the immune system. We've got a high prevalence of HIV in the country. It means that those women who are infected with HPV are likely going to have the HPV stay there, what we call persistence. The other part is what we think is the healthcare system failures. It's very difficult. Either access to prevention, to screening, or to treatment when the cancer is identified earlier.
So, talking about screening, one of the things women can do to pick up signs early is to have pap smears.
That's correct.
So, does the access to pap smears in the government system have something to do with Black women not being able to access prevention or screening fast enough?
Women will go and have a pap smear done, but time and again when they go, the results are not ready or they are not found. At some point, they'll be told, go and repeat another pap smear. And then they wait and they wait and wait again. Or when they go again, you get to be told that the person who deals with that part of the healthcare system is not available. So the truth be told that the healthcare system is also letting women down when it comes to screening itself and follow-up of the screening procedures.
How often can you get a pap smear in the government system?
We do it every 10 years. And ideally, do not start screening if you are less than 25. So currently, we are still on 10, 10, which means 3 times in your lifetime. But we are moving towards a 5, 5, 5, 5, which will increase to 6 times in your lifetime.
And that's very different from the private sector, right? Where women generally go once a year for a pap smear.
Yes, in the private sector, people are doing it every year. But I think we need to reassure your viewers that doing it every 5 years, as compared to the ones who are doing every, does not put you at a disadvantage at all.
So why is it so important to get vaccinated then? And when can you get vaccinated?
Naturally, a vaccine prepares your body to fight against the enemy before it comes. Remember, I said your immune system in the cervix is important. So the vaccine will prepare the immune system on the cervix itself, so that by the time you get that HPV, because again, 99% of people will get it anyway, so that the immune cells are prepared, so that you eliminate it. If you eliminate it, it means we are increasing the pool. Remember, I said 90% of people have a competent immune system naturally to get rid of it. So if you can give a vaccine, you might increase that pool to almost 100% of people to get rid of it. An example is there in New Zealand and Australia. They've almost eliminated cervical cancer because of the vaccine.
What type of cancer can boys or men get from HPV?
In the majority of things, we say men or boys are carriers. If you go back to what I was explaining, they bring the cancer. But we have not seen a lot of incidences of penile cancer from HPV as yet. But for boys who have sex with boys, they will have penile cancer, rectal cancer, or colon cancer from HPV. Or those who indulge in oral sex, then they might have a throat cancer. On its own, it's a little bit rare to see penile cancer as compared to cervical cancer. So boys can have cancer. And it makes sense that we must not treat the victim, we must also treat the perpetrator in this regard. So if we are giving a vaccine to the girls so that they don't die from the cancer, why don't vaccinate the boys so that they must not bring the HPV to the girls as well?
Is cost an issue? Is that why we're not vaccinating boys?
I think in our country, initially, yes. The biggest disadvantage is we are consumers, we are not manufacturers. However, my personal belief is it's not cost. I think this disease is political. Let me give you a scenario. If cervical cancer was affecting men, we would have long gotten the vaccine to every single living human being in the country.
Let's say you do get cervical cancer and you're a woman, of course. What happens? What can the government hospitals do for you?
If you do have cervical cancer, if it's an early stage, for example, cervical cancer stage 1A and 1B, we know those ones can be operated, you remove the womb, and then you get cured. Anything above that says you must get radiotherapy or radiation. Whereas if it's advanced and then it's late, then we have to give you treatment so that we control the pain, the bleeding, the comfort, so that your quality of life can improve. Currently in government, you can get all the management strategies. If you have cancer already and it's early, there are services for operating. If it needs chemo, you can get chemo. If it needs radiation, you can get radiation. However, access is limited because of the numbers that are there. There's a lot of women who are waiting for surgery, a lot of women who are awaiting radiation, a lot of women who are waiting chemo. To give you a perspective, ideally, you will say, I want to operate this patient within 2 weeks of diagnosis. Diagnose, operate in 2 weeks. What are we doing? Diagnose, operating 3 or 4 months, which is not ideal at all, none at all.
So if you look at this late access to services, what's the survival rate in the government sector for cervical cancer?
Ideally, you say you want the survival rate to be about 80 to 90%, which means 80 to 90% of those that you diagnose, in 5 years, you must find them alive. We are sitting at 60, sometimes less than 60. So because of the same thing, the ones that we diagnose now, by the time they come in 3 months, 4 months, if today we had said you are 1B, the stage 1B that needs to be operated, when you come, of course, for admission for operation, we have to reassess you. In most cases, we find that because we are waited for long, by the time they come, they're no longer operable. So we need to book them for radiation and chemotherapy. And when they go there, they are going to join another queue. And their waiting period is also the same 3 to 6 months. So if you can convince those who are against NHI and say that the advantage with NHI, we think it might work when it comes to cancer in this way. The reason it's not working is because we don't have access to theater. So you'll have one theater for one theater a week. In private sector, theaters are full, underutilized. If we can source those services there, in private sector, theater staff are there, doctors are there. There are more doctors in private than there are in public. They are there who can operate. Of course, even now, before NHI is there, if private sector can open up and forget about this business idea that they have about the cancer and say, we want to help, we'll charge you a minimum fee to access theater. And as government, come and operate. The doctors will flock in there, then we'll kill that waiting period. We can kill it and such that we can see a person today, in 7 days we are operating. And we are convinced that will improve the outcome with cervical cancer on women in the country.
Langanani Mbodi, thanks very much for joining us today.
Thank you. You're welcome.
There you've heard it. No woman should die of cervical cancer. We've got the means to beat it and to avoid surgery. That's your Health Beat. Thanks for watching. Stay well.